Hi, everyone. Good morning, good evening, good afternoon. Welcome to Lactation Education Resources webinar on Real Talk, the realities of being and becoming an IBCLC. I'm Angela Love-Zaranka, Program Director at LER.
Hello, and I am Sekeita Lewis-Johnson, the Accredited Provider Program Director here at LER. Welcome and thank you for joining us.
So just a little bit about us. I am a board certified lactation consultant. I started out in parent support, community support for lactation. I've worked in a hospital. I've worked in private practice. I've done some advocacy work, both nationally and globally and regionally as well. So I've got a wide, vast, different types of experiences providing lactation care to families over the past many years. How about you, Sekeita?
Yeah, thanks, Angela. So I started off in maternal child nursing and, loved it so much, loved helping families. I became a board certified lactation consultant in, 2008, not 2020, nothing, 2008. And so my experience and background is in the hospital setting, as well as home visiting, as well as private practice and community. And so Angela and I, we share similar experiences.
And the great thing is that those things that we bring to the table, the things that we share, as well as those things where we may have different experiences, we're here to enhance your understanding of what it means to become an IBCLC. Well, first we're going to start though with a little bit of housekeeping. So if you would like to ask us a question or make a comment, take a look at where the blue arrow is pointing on the GoToWebinar interface. You'll see that questions box right there. And so you're welcome to type in something, practice now. And why don't you, if you have a moment, please do type in where in the world you are participating today. If you are participating on a mobile device, take a look at where the green arrow is pointing at the bottom, where the question mark is at the bottom of the interface for GoToWebinar. And you can see that question mark. So please do ask us a question. Let us know where you are participating from today, or if there's anything else you need from us. Joining our webinar today is Wendy Lawrence from our amazing customer support team. Wendy has been with the company for many years, is very familiar with what it takes to become an IBCLC, and is also well-versed in all the content on our website. So she's going to go through and she will answer questions that are in the chat, and she's going to leave a couple behind for Sekeita and I to answer live. And we have Sonia here today, who is a member of our tech team. And Sonia is here on the call in case you have any tech issues, which you may be experiencing. So if you are watching us live, or if you're watching us later with the recording, we're really happy that you're here. And if you do have questions, if you're watching the recording and do have questions, please feel free to reach out to us at support@lactationtraining.com, and we're happy to find the answer for you. So let's dive in and take a look at what a lactation consultant is and how you can follow your passion and become one. If you decide to become an IBCLC, you will join more than 37,000 IBCLCs in over 131 countries and territories. Credentialing as a lactation consultant is offered by the International Board of Certified Lactation Consultant Commission. Take a look at their website, which is ibclc-commission.org. They have different regional offices depending on where in the world you reside or work. Review the requirements and pathways to become eligible to take the IBCLC certification exam. What do you need to know? The detailed content outline, also known as the exam blueprint, is based on surveys of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and the chronological stages an IBCLC needs to know in their work. LER courses cover the entire detailed content outline, and our courses are approved by LARC. That is the Lactation Education, Accreditation, and Approval Review Committee. They evaluate and approve lactation consultant training courses. Sekeita is going to review a few questions for you to ask yourself today as you're thinking about becoming an IBCLC. Sekeita?
Yes, thanks, Angela. So we are going to take a deep dive and we're going to go over a lot of information today. So before we dive in and before we go into all the things that you need, the realities of becoming a lactation consultant, please take a moment and consider these questions. The first question, as we start to talk about the skills that are necessary, it might be helpful to write this question down as well, is do I have the skills necessary to become an IBCLC? And we'll talk about what that means. However, you're on this call because you want to know how to become an IBCLC. So maybe perhaps you don't have the skills, right? But the other question is if you don't have these skills, where are you going to acquire them? That's the second part. So be cognizant of these questions. And again, it may not make sense all this time, the first time around. You might need to listen to this webinar a couple times, and you might need to reflect, excuse me, on some of the things that we say. So buckle up. We're going to go over a lot of things, and hopefully this will cause some reflection after you get off to really take a deep dive and analyze where you are in your journey. All right, so, excuse me, I got a tickle in my throat. What makes an IBCLC? I just talked about skills, right? And in anything that we do or that we're trying to do, competency is critical. It really means that you have the ability, the knowledge, and the skills to do something and to do it successfully. So in a nutshell, I'm talking about, for example, if you go to a cardiac doctor, but you have something wrong with your brain, right? I don't think your cardiac doctor is going to be competent, right? And there could be some harm caused in that. So what we're talking about is really having the skills that you can avoid causing harm. So when you first start off as an IBCLC, no, you're not going to have experienced every single situation. You will be what's considered a novice, right? That means that you have the foundational knowledge and you have some skills, but maybe you haven't seen and done everything, right? So maybe you're not the expert, but you have the core foundational knowledge and you are a prudent clinician that will avoid causing harm. And that's what you want at the end of your training. You want to be confident that you are not causing harm. And so competency is extremely important to who we are and how we practice. Culturally appropriate and credible. When we talk about culturally appropriate, you may have heard words like cultural humility, you may have heard words like culturally competent, although there are lots of healthcare providers moving really away from the word competent. But what does this mean, right? We really have to be clear on what we're talking about when we talk about cultural appropriateness. Some people say culturally relevant. As we're talking about this, we need to understand that we're using terms that make sense. And so being culturally appropriate is more fitting in some cases. So what this means is that we have to start with cultural humility. And cultural humility is a lifelong process of self-reflection and self-critique, where we're really not just learning about other people's cultures, but we're learning about ourselves and our own, and we're really analyzing and examining our own beliefs and cultural identities. There is a whole definition, and there's lots of definitions about cultural humility, but there's a definition that can be found from the National Institute of Health, and it states basically just what I said, is that it is a lifelong process of self-reflection and self-critique, whereby the individual not only learns about another cultures, but starts with examination of their own beliefs and cultural identity. And so when we're talking about cultural humility, it's important to not stereotype people. It's important to not say things like, oh, they usually don't breastfeed on the first few days of life. It's not in their culture to do so. You know, we want to avoid saying things like that because really we know that there are subcultures within cultures, and you don't know if unless a person tells you what their preferences are. So the first part of culture of humility is just not feeding into those stereotypes and not making assumptions about what someone will or won't do based on their culture, right? Because like I said, we don't know. So basically, culturally appropriate care is individualized care. And it starts with examining ourselves and making sure that we're not putting assumptions onto others. And credibility really starts with delivering culturally appropriate care in some instances. You know, you want to be a credible resource. And are you a credible resource? When you're asked a question that perhaps you don't know the answer to, how do you usually respond? You know, there are some people who try to respond with based on their own experience. They'll tell you something just off of a whim, right? You want to avoid doing that. You know, because it's important that we understand that when someone is asking you a question about their situation, they really need and deserve a reliable source, reliable evidence informed information. We don't want to start by saying things like, oh, well, I breastfed and it didn't hurt me. Oh, or, you know, I breastfed and it really did hurt the first. No, no, no. You don't want to rely on your own experience. You want to rely on the evidence. So being a credible resource means that you're giving out information that A, coincides with the best evidence, and B, you really know what you're talking about. So what does the evidence say? If you do not know what it says, then perhaps you know where to go find it. And so we're not all walking dictionaries or walking computers, and it's really impossible to know every single question that you may be asked. But showing credibility is about saying things like, okay, I know enough to say, you know what, I don't know the answer to that, but let me get back to you because, you know, I got to go and dig into this resource. That's how you establish credibility. One of the things that can happen if you lose credibility as a lactation consultant or lactation supporter, that means that all of the rest of us that's been practicing for years, are in jeopardy of losing credibility. People may begin to not trust that we can really be helpful and help them achieve their goals. And so you really want to be careful with how you give out information and what information you give out. We are policy advisors, and we also help to create policies. And that's the other things we do as IBCLCs. So it's important to know from the standpoint of talking about clinical care, you know, there are policies for all types of clinical care, and there are policies that govern how we act, how we conduct ourselves in a clinical setting. So, and there are also policies that determine individual rights, right? It's just like the Pump Act that just is a policy that just passed. And so if you have policy as a strong suit and a background, yes, we do that. We need you. However, if you don't, that's okay. We still need you, right? Because maybe it's not your strong suit, but we are also stakeholders. We are also individuals that sit at the table that really advocate for certain causes, for certain policies that really remove barriers to disparities of human milk feeding. So really advocacy informs, and it's a big part of what we do. We simply advocate for a particular cause. In this event, we are always advocating for human milk feeding, breastfeeding, chest feeding, any way we can really, from a health prevention and promotion standpoint, discuss how important it is to remove barriers to human milk feeding. So even if you're not a policy advisor, so to speak, you can be that person at the table listening to how policies are created so that you feel a little bit more confident in speaking up and advocating on certain policies. Problem solver and researcher, those are two words that go hand in hand because problem solving is about 90% of what we do because each family have their own concerns and components and issues. So when we're called to support families, it's usually because there is something wrong. And so we really can't walk in with this one size fits all type of mentality, because we know that one size never fits all. We have to really think about, okay, what are the needs and concerns of this particular family based on what they're sharing with us? And then along with that, we have to be able to say, okay, this is what it looks like. Okay, this is how I can help, and this is what I heard you say, right? Or, oh, I don't really know. Let me go back and let me go and look this up. That's the researcher part, right? There are two ways to be a researcher. There are IBCLCs that are actual academic and scientific researchers, and there, if you read anything or know anything about lactation and about breastfeeding research, there's a lot still to learn and to know. There's a lot lacking. We can always use evidence, right? So we need you in this profession as well. But we also have folks that need to verify information, and that's the other way we research. So let's remember, I said we're not all walking around with computers inside of our heads. We have to use the tools that we have and go back and research and look up things to effectively problem solve and get to the gist of what our families are needing in that at that point of care. To be an IBCLC is to be able to deliver high-level lactation care, skilled high-level lactation care. They go hand in hand. And when I'm talking about high-level lactation care and skilled lactation care, I'm basically talking about delivering the level of care that is necessary for that family to prevent premature weaning. And this is all based on an acuity model that was developed by Rebecca Mano in Oklahoma, where there are certain levels of care that need to be delivered based on maternal and parental risk factors, and then combined with infant risk factors, right? So I'll give you an example of what I'm talking about. When we're talking about basic breastfeeding care, such as, assisting with latch and positioning, sometimes the families just need just a little bit of assistance, maybe even not even a touch, maybe just reassurance, or maybe just a suggestion. That's a level one. That's not really complicated. That is really someone who has foundational knowledge in uncomplicated lactation. And okay, I can do this. I can help you with this. Versus someone who is in the ICU, rather, who is intubated and on life support, who basically stated their wishes prior to going to ICU that they wanted to lactate. Are you able to consider all the things that's going on with that client in the ICU, and perhaps what's also going on with the baby? Are you able to look at that person and say, hey, I need to consider everything. I need to consider the medications that this person is on. I need to consider their condition. I need to consider whether or not the ICU nurses know how to manage lactation. There's so many things that can go into that. And also, what if this person had a brain injury? And what part of the brain was injured? Are you able to make all of those connections that are necessary? And that would be considered what's a level 3 on a level 3 on the acuity scale. So when you're doing your training, sometimes it's tedious. It's a lot of information, and you might be like, why do I need to know all this about the brain? Why do I need to know about the cranial nerves? Trust me, you need to know, because that is definitely what sets us apart in the level of skill that we're able to deliver and bring to the table in those high acuity settings, right? So I just gave you a really horrible case, right? Don't get scared. Please don't get scared. But I gave you that because I need you to understand the significance of when we say skilled and high level, that's what I'm talking about, right? The expectation is not that you come out, you sit for your exam and you know all the answers to that particular situation. No, that's not it, because you're not going to see every single thing. You should expect to have the entry level novice background foundational knowledge, but you should be building up to that. So if you're in your clinical experiences, Don't shy away from learning about some of these things. Try to get all of the skills. And then once you build up on the foundational skills, continue to build upon your knowledge set and your skill set. And so that you will develop into the expert mode. Essential and timely, essential and timely care. One of the things we found out during the pandemic was that essential became a new buzzword, right? And we also found out that lactation consultants are essential because babies are still being born. They were still being born. People were still having children, and we were actually at the height of a critically emergency situation where we needed to protect lactation. We needed to protect human milk feeding because we didn't really know what was going on, right? And we found out the ability to provide human milk during emergencies is critically important, not just from the bonding and the family standpoint, but also from public health and prevention, from a public health and prevention standpoint. So yes, we are essential. And it's important that we show up when we are needed, that we are timely, and that there are times when we can't say no. And I often say and ask the question, like, what if we would have said, oh, we're in a pandemic now, so I don't know when this thing gonna be over, so you're gonna be on your own. How prudent is that as a clinician, as a professional, as a healthcare provider? Not so much, right? We are frontline workers, and I just want to make it clear that yes, telehealth is an option. We know that. We talk about it. It is great. But also, we found out that the infrastructure in certain places wasn't really cut out to do telehealth sometimes. And it's not the end all to be all. We can miss some things. We use our sensory, all of our senses when we're doing assessments of families. And so telehealth can sometimes prohibit us from using other senses, and we may miss some things. And then there are other cases where telehealth is very appropriate, right? But I really do want to stress the point of being timely, because once there are certain places that sometimes you can't even get in for 2 weeks. And imagine what that does to that family who is waiting for assistance for 2 whole weeks, right? That's going to make or break that situation. No, it's not going to make it. Chances are it might break it, right? So, I want to just make sure that, you understand that it's our duty to show up so that we minimize harm that's caused to families, that we are accessible, because that is truly the spirit of being an IBCLC. It is really providing accessible care at the time that it is needed. A trusted collaborative care partner. This is my favorite phrase. Angela's probably tired of hearing me say that, but I say it all the time. I love collaborative care partner because what it assumes is that you are collaborating with your client. It is the knowledge that you are not the center, you are not the decision maker, you are the collaborator. It is the family, it is their partners and their goals that takes precedence over your goals for them. We are some of the, we love, people in this field, we love breastfeeding. We love it, right? And so sometimes we're like, yes, the recommendations are exclusive breastfeeding for the first 6 months, and we go in. We really like, we almost preach this thing, right? However, it's important that we honor those facts that we know, but we also listen to the family's goals. We have to understand that we are collaborating in partnership, in agreement, and that when someone seeks our care, that we approach it in that manner, that we don't overstep boundaries that are not meant for us to overstep. And that's how you become trusted. That's how you become trusted to do no harm, to be reliable. And it's a way of stepping back and really in your actions, what you're saying is, I see you as a person. I see that we're in this together. I'm not higher than you. We're just collaborating to do what is best for you. There are certain clinical situations where I've seen that people go in with this hierarchical hierarchical type of way of being and doing. And they go in like, yep, I'm the expert. I've been doing this for about 15 to 20 years. I've been supporting families. I'm going to tell you how this should work. Trust me, blah, 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 blah. You go in with your spiel, right? You're going to lose trust, no doubt, right? Or what about when you go in and someone has asked you for latch assistance and you go in and you will see them, you know, the baby is at their chest and you just go in and you just start touching and here you go, this you go, I'm gonna do this. You know what? Again, that's another way to lose trust. It's important to ask families, how is it? Can I assist you? What type of assistance are you looking for from me? That's how you become trusted, and that's how you become a collaborative care partner. So all of the things that I talked about, care, collaboration, culture, communication, they are all around the person. And this is basically what has been determined by the Institute of Medicine as patient-centered care. Patient-centered care can also become a buzzword for some. The definition is actually providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guides all clinical decisions, right? So I've talked about all of this in a nutshell in all of the preceding slides. I really want to leave you with the impact of not allowing this to become a buzzword, but really operationalizing all of these facets and practicing what this model looks like. So before I leave you today, because Angela's going to jump on and she's going to start to talk about the pathways, I really want you to think about a few more questions that you may want to consider while Angela is talking and even after she's talking. These are questions that you can reflect on, is it feasible for you to begin your journey now? Or where are you in your journey? But what pathway is the correct pathway for you? You might want to write that down. What does the local market look like? Where are people in private practice? Are they in hospitals? What does private practice look like? Is the area saturated where you are? Probably not. You also want to think about the training that's involved, the clinical skills. How does this fit into your lifestyle? What are your current job commitments in your family? Write all these things down and reflect on them. Do you need mentorship? If so, how will you get that, right? Think about all these things, write them down, journal about them. It will help you come to some great conclusions on where to go. And with that, I will turn it over to Angela. Angela, take it away.
Thanks so much, Sekeita. Okay, so the process of being an IBCLC can feel a little complicated. We're getting a lot of questions in the chat, so please do keep them coming. I'm going to take this roadmap and break it down into smaller pieces. Now, we're going to touch base on this later in today's presentation, but as you listen, know that you don't have to go out and find each one of these things. LER has ways to help you with each step of this process. So first, you're going to need to choose a pathway. We're going to come back to this in just a minute. Each pathway has three components. They are the education piece, the clinical hours piece, and then getting ready for the exam. Okay, so the first component is the health sciences education. It's a typical education for healthcare providers. There are 8 post-secondary or university level courses and 6 general education subjects. You can find a full list for each of the 14 subjects on the IBCLC Commission website. You can search for it, or you can find the link in your resource document during the webinar. Take a look at the GoToWebinar portal and you will see the link for the handouts. Now, the 8 university level courses are, and you don't need to write these down now, biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally sociology or cultural sensitivity or cultural anthropology. They can be online or in person, as long as the institution is accredited to provide the learning. If you took any of these courses during your college career, they count, even if it was 20 years ago. LER partners with Walden University to provide these basic courses. Walden is online, and they've chosen the courses to best fit the Commission's requirements. The 6 general education subjects are medical documentation, medical terminology, occupational safety and security for health professionals, professional ethics for health professionals, universal safety precautions and infection control, and basic life support. 5 of the 6 general ed courses can be taken through LER. The only one you'll need to search for is basic life support. In many countries, there is an in-person skills check for this training. I've heard of some organizations providing this training completely online, so it's important to check with your local resources. The guide, the guide that IBCLC has listed on their website, it provides general descriptions for the typical courses in each subject area. Please keep in mind that the IBCLC is international. The names used in their documents to describe the courses may not exactly fit the description of the course at your accredited educational institution. That's okay. You'll note these broad terms with the understanding that there is no one universal definition for what a course in, let's say, clinical research will cover. Now, why are these 14 courses required? The IBCLC is a standalone credential, meaning you do not need another certification, degree, or license to practice as an IBCLC. Once you pass the exam, you will be an allied healthcare professional. The courses will help you to be prepared for your career, as well as to help you pass the exam. Now, the second thing you need is lactation-specific education. This is where LER has you covered. The education should be comprehensive and cover the detailed content outline. The Commission requires at least 90 hours of lactation education and 5 hours on communication skills and 2 hours on the World Health Organization's code for the marketing of breast milk substitutes. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. And I should be specific and say that 5 hours on communication is specific to your work as a lactation consultant. Now, the third component is lactation-specific clinical experience. This can be in-person consultations, telephone consultations, or online breastfeeding and lactation support that supports breastfeeding families. It also includes lactation assistance to pregnant and breastfeeding or chest feeding clients and lactation education to families and/or professionals. These hours are to be obtained within the 5 years immediately prior to applying for the exam. How many do you need? Well, that's going to depend on your pathway. So the clinical hours need to be accrued in the 5 years prior to applying for the exam. So here's a quick overview, and I'll review more in the following slides. So pathway 1 is for healthcare professionals and those who provide breastfeeding support through an IBCLC recognized breastfeeding support counselor organization. According to IBCLC, healthcare professionals include physicians, nurses, midwives, dietitians, physical therapists or physiotherapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as Lactation Education Resources and La Leche League International or the Australian Breastfeeding Association. Now, Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both didactic and clinical components, and they require 300 clinical supervised hours working with those breastfeeding families. Pathway 3 is a structured mentorship program between an IBCLC and the applicant. The IBCLC or IBCLCs, if there are more than one, must be in good standing with IBCLC. Those who choose this pathway must have their program pre-approved by IBCLC prior to beginning to accrue their clinical hours. So a quick note, for those of you who may have breastfed, chest fed, or provided human milk for your child, the hours you spent nursing, pumping, and helping your friends unfortunately doesn't count towards your clinical hours. Now, while 500 or 1,000 hours seems like a lot, there's a really good reason why. Each candidate needs to have the clinical experience they need so they can provide competent care as an IBCLC. If it's any consolation, the number of clinical hours used to be a lot more. I've known IBCLCs who needed anywhere from 2,500 to 8,000 clinical hours to sit the IBLCE exam. So pathway 1. So this is the one where you're going to need at least 1,000 hours. For the candidate who is also a healthcare provider, these hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBLCE recognized organization, their hours can be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. The hours need to be counted on an hour-by-hour basis. So 2 important points about these clinical hours through pathway 1. It's important that you document your hours as you accrue them. Be very detailed in case IBLCE chooses to audit your application to take the exam. They may want to see documentation such as a spreadsheet or another document where you counted your hours. And the second point is these hours do not need to be directly supervised. Please note that LER has a program for those of you who are not already affiliated with the Breastfeeding Support Organization. The LER Hours program for our certified breastfeeding specialists offers you a way to gather those 1,000 hours in your community. Pathway 3 requires 500 hours of clinical experience. It's best done in a busy practice setting where you can work with many breastfeeding, chest feeding people, and those providing human milk for their babies each day, such as a hospital or clinic setting. The hours count towards the 500 only when you're actually working with families. Observation hours do not count. Now remember that clinical experience is graduated, meaning that it starts with observation, then doing tasks under supervision, then completing tasks independently with the IBCLC nearby to answer questions and discuss situations. We have an internship program with many sites around the United States. Reach out to support@lactationtraining.com and we can connect you with our clinical internship director, Amy, to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate an internship site. Now, one thing Amy wanted me to mention during this webinar is that you can't start to count your clinical hours towards the internship requirement until both you and the IBCLC are comfortable with you working independently. Most interns spend approximately 75 hours in orientation before you can begin to accrue the 500 hours. Or you can take a look in your community to find a willing internship site or mentors. You may need to reach out to many people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk to others who've been through pathway 3 to find those successful strategies in finding that good mentor. Now, while this pathway has an additional step or 2, some people will ask, is it worth it? We find that it is. And the answer why is my speculating that IBLCE actually reports that students who come through this pathway score best on the exam. And I think it's that mentorship piece, which is the key component. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway. Now, as far as clinical hours are concerned, some people are asking whether or not they can accrue them via telehealth during the pandemic. And the quick answer is yes. The longer answer is paraphrased from IBLCE documents. IBLCE will allow the use of technology if certain parameters are met. You will need to pay attention to the privacy rules and the Code of Professional Conduct, as well as clinical competencies for IBCLCs. Now at LER, We have two ways for you to gather your lactation-specific education. One is the Lactation Consultant Training Program, also known as LCTP, which is the full 95 hours front to back. The other is either our core or bridge course. They are designed to meet your education needs depending on your background and previous lactation training. So the 95-hour course Lactation Consultant Training Program is everything that you need. It's eligible for CERPS, CME, and nursing contact hours. It's intended for those who do not have any lactation education and they know they want to become an IBCLC. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices such as your computer, tablet, or phone. They are optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We are not new to this, we're true to this. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we update sooner as new evidence emerges. Have a question for the instructor? You can send an email to our support forum and we have IBCLCs available on our staff to answer your questions. Want to discuss a concept with your fellow students? We're discussing innovative ways for people to connect. Stay tuned for more information. Upon completion of the 95 hours, you're eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you are a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With this certification, you can begin to collect your clinical hours towards the IBCLC exam. Now, if you're not sure where to start, or you already have some lactation-specific education, then we have our core or bridge course to meet your needs. They have the exact same advantages as the LCTP course. Our initial course is called Core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's 52+ hours of online education. It covers the basics such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is the Certified Breastfeeding Specialist exam. The bridge course is ideal for people who have the basic lactation education components and need an additional 45 hours to qualify for the IBLCE exam. Topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. If you're not sure where to start, I would say, and you're new to the profession, I would suggest taking the core course, just so you can try out the course and see if becoming an IBCLC fits in your life and in your schedule and your passions. Now, I know that these requirements seem like a lot. We are here for you every step of the way. If you have any questions about the pathways that we don't answer today, please be sure to reach out to our friendly customer support department. As I mentioned, many of our team are IBCLCs and we know the process inside and out. LER has 3 ways for you to earn your education, depending on your goals and where you are right now in the process. If you have questions about what would be right for you, again, our customer support team is here to help. If you're not a healthcare professional working directly with mothers and babies, getting those hours can feel like a challenge. We have 2 programs, one for Pathway 1 and one for Pathway 3 students. And when you're ready to take the test, LER has you covered. We offer 2 versions of our very popular IBCLC exam prep course called QBank. It's a comprehensive system which includes practice exams, photo flashcards, anatomy flashcards, a study schedule, and much more. For those who take our 95-hour course, we include a discount on our exam prep course. Now, our 90-hour course, as well as Core or Bridge, all of those courses are available in Spanish. Capacitación en Lactancia is our website, which provides the same high-quality education found on LER in Spanish. At LER, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of LER's commitment to increasing access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. In alignment with our continued commitment to diversity, Lactation Education Resources is proud to announce our Rising Tide Lactation Equity Scholarship Program, designed to increase the number of Black and Latinx and Hispanic IBCLCs in the United States. We recognize one of the greatest obstacles to entry into the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for the Rising Tide Scholarship awardees. We alternate these scholarships each year. In 2025, we will host our Juntos Triunfamos Scholarship. You can find out more information on our website, lactationtraining.com/rising tide. Our team is here to help you now and in the future. You can get tech support, which is open 7 days a week, get your questions answered by experts in the field, and we can provide you with ongoing support for the next steps in your lactation career. For example, someone recently reached out to one of our instructors to ask a question about their own practice, and we were able to connect the instructor with the student. And so they were able to receive additional resources in order to help them to support the family in their community. Another student had a question about developing a policy at their hospital, and we found the appropriate instructor to answer those questions and also to provide additional resources. So thank you very much for your time today. Sekeita, as I'm getting ready to turn it over to you and or to ask you to join us, I just want to make a quick note. I was on the IBCLC Commission's website today, and I know that we have this wonderful handout which has a lot of helpful websites for you to find out more information. And it's really important to keep an eye on the IBCLC website and the Commission's website. For example, for those of you who are planning to apply for the exam in the coming weeks, this is in 2024 to take the 2025 exam. I just found out that IBLCE is actually raising the exam fee by $35 US. And so be mindful of that as you are planning, that it is important to take a look at the IBCLC website on a regular basis throughout your process, as well as when you are preparing to take the exam, because it is a dynamic website and they do make changes. Usually they will put things on their social media, but myself, as well as one or two other IBCLCs, including our communications person, as well as one of our customer support staff, we haven't noticed. And so had I not gone to the website today to check on the key dates, I would not have been aware. So I'm just saying this out loud to make sure that everybody pays attention to the Commission's website. So thanks for that pause, Sekeita.
Yes, thank you, Angela. No, thank you for that information, because, sometimes we think we know, and then we write that check out, and then that application gets sent back, and that can delay some things. So I appreciate you for that. Thank you.
Mm-hmm.
All right, so let's go in. There are lots of great questions. So thank you all for your questions. We're going to try to answer them to the best of our abilities. And so the first question is a three-part question, Angela, first. So we're going to tag team this, okay?
Okay, good.
The first one, it says, when and how do you find the opportunity to get the 500 hours? So my assumption is the 500 hours you're speaking of is mentorship through Pathway 3. Right? And so the opportunity can exist by searching for mentors in your area. That sometimes means, being connected with individuals that share your passion. You can find such individuals through any local coalitions, breastfeeding coalitions in your area, or any birth worker areas where they're doing certain things to collaborate and come together. Those are the types of mentorship opportunities that could exist. Now, as a mentor myself, and I have provided mentorship, I want to be really frank and really honest about mentorship.
Mm,
Mentorship requires giving of ourselves. It requires making sure that clinicians have the skills and the knowledge and the know-how how to do that, right? And so with that being said, for me, anybody that I mentor, I have to have built a relationship with. I have to understand that and know that this person is of integrity, that they really want to do this, that I'm not going to be like beating my head against the wall because this is my service, right? And so there are all different types of mentorships. There are
mm,
sometimes mentors where you're required to pay fees to them for their mentorship. And so there's many creative ways out there to find a mentor, but those are just some of the things that I want to add to the conversation. Angela, what about you? What do you think? What are your thoughts?
well, I think that it is being a good fit for both the mentor as well as the intern. I think that's something which is important. Also, I know that some folks, they want that sort of pathway through that internship program because they think it's going to be faster for them. And so it's not just that nurturing and the support that you get from an IBCLC, but they want this today, right? They just want to get this done today. And yet, if you take a look at some of the questions that Sekeita asked earlier, are you able to commit your time to support that program? Like let's say, for example, it's in a hospital setting. You're going to have to be able to get into the door at that hospital. So there may be some hoops that you need to jump through at that hospital. For example, there may be some, training requirements that you may need. There may be a health screening that's required before you can actually go in and support people at that hospital. If you're working as a volunteer through the hospital system, that is an extra piece that you need to consider. And if you think about it and think about those questions, like let's say, for example, you've got 3 kids and they're all school age, and you have a lot of support and a lot of assistance, but when you actually take a look at your schedule, you realize, well, gee, I can really only get those clinical hours 1 day a week, right? And it has to be during school hours of 10 to 2 or something. So then when you start to think about it, then you're like, oh, wait a minute, that's only 5 hours a week that I can accrue. And Angela said it's going to take like 75 hours before I can even start counting my hours. When you start thinking about it in that way, that's why Sekeita wants you to map this out. Think about this first. Take a look at your other responsibilities. If you have a job yourself, what days can you take off in order to do this if you can't do it within the regular course of your job?
Yeah.
So is there anything else,
Yeah, thank you for
Sekeita?
that, Angela. Yes, this is the second part of that question. Is it harder to get a job as an SLP turned IBCLC as opposed to RN? I'm assuming, I'm going to make the assumption that this is talking about hospital work. I have actually worked with an SLP IBCLC. I've worked with an OT IBCLC in a hospital setting. And I will say that it depends on your geographical area. So remember, I said analyze the market in which you work. I do know IBCLCs that do not have an RN that are in hospitals. I actually know more than a handful of them. And when I say more than a handful, I mean more than a handful. And so as we work to advocate for removing that as a barrier for an equitable compensation, I'm just saying, keeping it real here, the realities, that there have been and there is space being made for folks who are not registered nurses. Anything to add? Because Angela, there's a third part.
We just saw me point to myself. So I did work about 20 years in a hospital setting, and I work exclusively as an IBCLC. So I don't have any other credential or license in order to practice. So it is a standalone piece. It's just as Sekeita said, it's a matter of equity, and it's a matter of educating hospital personnel, especially the C-suite, that indeed lactation care can be provided competently and safely as an IBCLC. So what
Yeah.
else are you thinking, Sekeita?
I want to say standalone. I love that word. I will beat that word to death because I don't know when this started that IBCLCs became synonymous with RNs, because they are totally not. They are totally not. As an RN myself, I can say, I won't say all the things that I'm thinking, but anyways, hold on. Let's go to the next one.
Where's the third part?
How do I narrow down my study for certification? I don't, I don't know. Angela, you got any thoughts about what this question may be asking?
I think that you may want to take a look at the detailed content outline or the exam blueprint in order to know, because the detailed content outline lists every subject area that you need in order to become an IBCLC. So for example, under pathology, it's going to give you a list of things, like maternal issues, infant issues that are all pathology, and you need to know all of those things and how they relate to lactation and how to support the families there. Esophageal atresia, tetheral tissues, mastitis, infant cancer, maternal cancer, right, or parental cancer. So I mean, all of those things are how you need to narrow down, and specifically how they impact lactation, how lactation can be impacted by those different conditions. There's also the psychology, sociology, and anthropology piece of it. It's the family, it's the support systems, it's back to work, it's all sorts of different aspects there as well, clinical skills. So take a look at the detailed content outline, and that may be, I think that may answer the question that you have.
Yeah, thank you for that. Next question. I have my health sciences associate's degree and I am a doula. After I do the lactation education, am I able to gain my hours during my doula services without supervision, or does that profession not count for unsupervised hours? So I'm going to say you will not be able to do your hours without supervision. You either have to be linked through Pathway 1 through a breastfeeding support organization, or you need to be linked through Pathway 3 with a mentor for supervised clinical hours. And so I hope that makes sense. Angela, anything to add?
Just to add that indeed, since I'm co-presenting here with my colleague who is a doula, Sekeita, indeed, the hours that you spend with families is something which is really, it's so important, it's so vital, it's such a relationship, it's such a beautiful relationship, and you can count those hours as long as you are going through Pathway 1 through an accredited breastfeeding support organization. And to say that IBCLC, whether or not IBCLC recognizes, that sort of, certification as a doula, that's something that has to do with their exam process, right? I recognize, and Sekeita, we recognize the incredible works that doulas do in order to support, lactating people and people, especially in the postpartum period, that prenatal education and everything else. So just want to highlight that piece of it. We see you, we know the work you're doing.
Absolutely.
And so, yeah.
Vital to make all those connections and be like a one-stop shop.
Yes.
I love that part of being a doula, is that, I come with it, all of it. So, I'm able to assist during the postpartum phase in that regard. All right, so the next question. I know that you said that clinical hours can be completed online and over the phone. Does your internship matching program help pair students with clinical hours of this type?
So from a Pathway 1 perspective, if you're a certified breastfeeding specialist, then you're going to be doing it in your community, and it's 1,000 hours. As far as the Pathway 3 program, I would say of all of our internship sites, 95% of them are in person. And because many of these sites are in hospitals as well as in lactation clinics, and so I believe that the requirement is going to be more of a in-person aspect, at least with all the, and I'm pretty sure about that fact. I can always check with our clinical internship supervisor, our director, Amy, but I'm pretty sure about that answer. So indeed, we cannot necessarily match folks who only want to do it virtually or over the phone. I don't think we have a Pathway 3 program that can meet those needs. I could be wrong.
And I would like to add, that would be a disservice to only be able to do clinicals, get your experience over the phone.
Pathway 3, yes. Pathway 1,
yeah,
it's possible. I mean, I respect what you're saying, Sekeita,
Yeah.
or I expect your feeling behind that.
Some hands-on, some clinical hands-on is always, I'm going to always advocate for that, simply because, again, we talk about being competent, causing no harm. Those are very key critical things that I'm like, you know, some things require hands-on touch, and I won't beat that dead horse again. So next question.
Next question.
I love this. Can I say this question is, I'm a pediatrician and neonatologist. I discuss breastfeeding with families on a regular basis when I'm at work. I'm interested in becoming an IBCLC to gain more knowledge so I have more meaningful conversations with my patients and offer more assistance than the basics, especially when lactation specialists are not readily available. Can I use my years of experience towards my 1,000 hours? That answer is yes. There is a calculator and way to figure that out on the IBCLC website. And I believe that's, Angela, anything else?
No, I think that's it. And it sort of dovetails into the next question, which is some people are asking whether or not they need the lactation specific education or they need the college courses or anything before they can start providing care. And, you know, frankly, I would say I think it is important for you to have that lactation specific education, at least, you know, at least half of it, the 50-hour core course, that 52+ hour course. And the reason why is because then you're providing accurate, up-to-date, evidence-informed information to the families. And, you know, many times I know in myself that when I've been doing things for so long and I've been like, you know, sort of answering things in a certain way that if I don't have the latest evidence myself, Sekeita, I think there was a time when you know, called me in and said, hey, Angela, I think what you're saying is not quite right, right? And I at first I was like, no, really, and then I was like, oh, thank you very much, Sekeita. Yes, you called me in, and yes, you're absolutely right. I missed on this one, and made sure that I acknowledged that I had missed on it. So indeed, it's important to have that up-to-date information when we are supporting families in the moment and teaching as well.
And thank you, Angela. It's important that we hold one another accountable. That Angela has called me. Now I have to say, Angela has said something to me like, hey, Sekeita, you know, and I love that. That's the way it should be as clinicians. We have to get comfortable with really calling each other in so that we make sure I don't say something and then somebody else say, oh, Sekeita said this, and they take it at face value and it's wrong. No, horrible, right? And so it's
go look it up.
Honor that. Yeah.
Yes. Well, and that goes, do you see this last one here about the recognized healthcare professional list?
No.
So someone just typed in, looking at the recognized healthcare professions list, I see dentist, but do you know if a dental hygienist is a recognized healthcare profession? And so Wendy, on her game, actually posted the link to the commission's information on who is considered a recognized healthcare professional. And so, yes, you can email them directly. And again, if it's not on the IBCLC list, it doesn't mean that you're not a recognized healthcare professional in your, you know, geopolitical region. And it's just what IBCLC recognizes.
Yeah.
And I believe IBCLC will recognize those. It's not whether or not you're actually considered a healthcare professional as much as, do you have those post-secondary educational courses which will meet what IBCLCs need to do. In other words, as a dental hygienist, and I'm asking this question because I'm ignorant and don't know the answer, does a dental hygienist have anatomy and physiology, nutrition, psychology, sociology? You know, is that something which is part of a typical training for dental hygienists around the world? Clinical research.
Yeah.
And so it's just what IBCLC is looking at from a professional perspective to determine if they have those sort of prerequisites from a post-secondary perspective.
Yeah. Thank you for that, Angela. There's another question, and I really love this question because there's another pathway that's not getting a lot of attention. This question says, is there financial aid support for this? Yes, if you do a Pathway 2 program, which is college affiliated, that is the way that you can apply for financial aid. And so we do, I know Angela spoke about our partnership with Walden. And that is a way that students are able to apply for financial aid to start on the journey to become an IBCLC. So absolutely, there is financial aid and support available for Pathway 2. Now, for all other things, sometimes there's scholarships available. You got to kind of search for them. They are very competitive. I know, as we had a scholarship and we had close to 400 folks
So
that
many
we had to weed
responses.
through. So there
Yes.
are scholarships available that can provide some financial, reduce some of the burden. But for Pathway 2, definitely you can do financial aid. You can fill out for financial. Yeah.
And someone had asked earlier when talking about the scholarships that there was a scholarship for Indigenous people. And indeed, it is something that we are exploring and investigating, and we really want to partner with an Indigenous organization. That is the way that we believe that we would then be authentically doing the work. And we do have a few, we do have relationships with Indigenous organizations. So it's a matter of really listening to those, to the people in those communities in order to determine what the best course of action should be. And so please do stay tuned. And hopefully we'll have more information soon.
Yeah, thank you for that, Angela. Next question. Do you see students getting clinical hours while also having the commitment of working full-time at unrelated jobs, or are clinical hours less often attainable for those who have to work? That's a loaded question because it depends on if your work is part-time or full-time, what length of shift you're working. Perhaps if you're working 12-hour shifts, that could be creative in how to get and achieve those hours. But if you're working, for example, 5 8-hour shifts, right? And then you got 2 days, that could be a little challenging if you also have family, right? So I think that it's attainable once you do a plan and figure out how you're going to get your clinical hours and what length of time is it going to take you and what pathway you're going to be on. It is attainable. I will say most people do this while working. It's just the how to is more individualized for your situation. And it may require sitting down and talking with another IBCLC about how they did their hours. I can tell you, as a nurse at the time working 12-hour shifts, I was very creative because I could only use a certain percentage of my hours, because I did pathway 3. I could only use a certain percentage of my hours as time worked. So I actually had to come in and volunteer hours. So for example, as a nurse, I worked every other weekend. Well, I had to work every weekend at that point, because when I was not working to get paid on the weekend that I was off, I was coming in to volunteer to get my clinical hours. And so there's various ways to be able to do this. It just depends on some forethought, some really thinking about it, and talking to people around you to see how you can make it work for you.
Agree. That's a good point.
Yeah.
Okay, good. I think we've come to the end, Sekeita.
Yeah. Great questions today. Thank you. This was great.
Yes. And last question. My health science degree covers all 14 prerequisites. So there's, so if as a doula, I started to work at a birth center or lactation center or recognized breastfeeding support counselor, as long as it's supervised, since I have those prerequisites. Okay, so the college courses are one piece of it. And so it's the lactation specific education that you need. And then you need to decide if you want to do pathway 1 or pathway 3. So if you have the college courses, that's good. If you're working as a doula in a birth center or lactation center, or as a CBS, as a recognized breastfeeding support counselor, specifically a certified breastfeeding specialist, those can be either supervised or unsupervised. It depends on if you're doing pathway 1 or pathway 3. So the prereqs, the college courses, are the same. And then how you get those hours, it's either pathway 1 or 3, unsupervised, supervised, 1,000 or 500. And so it just needs to be in an approved setting, right? So it needs to be in that sort of approved setting. I hope I answered that question sufficiently. Yes, I did. I got it right. Okay, great. Good. That was a great question. That's a great way to sum it all up, right? Put it all in a package, right, Sekeita?
I love that. Yes, it is. A great way to conclude.
Awesome. Well, I hope you all have a good rest of your morning, afternoon, or evening. Thank you very much for joining us today. Anything else?
No, thank you, and good luck and best wishes as you try to figure out your journey on this pathway. And please let us know if you need anything at support@lactation.com. Enjoy. Goodbye.
Thank you. Bye-bye.